Linda Candelius. I'm a licensed clinical psychologist, and my specialty is in reproductive health. A majority of my work is focused on fertility counseling. And fertility counseling really is designed to help support people with coping strategies as their mood fluctuates through fertility treatment, whether that's medication-induced or just induced by how difficult the process is. I want to talk about how hard it is to be facing a medical diagnosis like infertility and not having any answers, not knowing who to blame, what caused this. It's so easy to take that and turn it back on yourself and blame yourself. And one way you could do it is by labeling it psychological. So be mindful. If you're asking yourself that question, there's nothing wrong with it. It's normal, natural to be looking for answers, but this is probably in a space of self-blame. And the good news is you can work on self-blame. I actually talk extensively about self-blame in a webinar on my website if you'd like to check it out. Self-blame is something that you can lift. It's something you can get rid of. Does it take a lot of reframing? Does it take a lot of psychological energy? Absolutely, but it can be done. Whereas medical conditions, sometimes you don't have that kind of control like you would with self-blame. We know that a diagnosis of infertility is going to link to mental health symptoms like anxiety, depression, even trauma. We have conflicting evidence on the relationship between stress and infertility. And when and if we ever had strong evidence that there was not just a link, but a cause, you would see so many more individuals like myself working in this space, and you would certainly see us at every reproductive center. We work with stress reduction in the fertility space as mental health providers. We're not suggesting that lowering your stress is going to get you pregnant. We want to help you because stress is just going to add on even more emotional challenges that infertility already does. Today I want to talk about cognitive fusion. Cognitive fusion is when we believe that our thoughts are who we are, that our thoughts are true, thoughts are real and valid and really mean something as it relates to who we are. When people are going through an infertility diagnosis and experience, a lot of times I hear thoughts around inadequacy, that people do not feel like they're good enough. It's really tied into this idea around reproduction, that their value, their worth is so wrapped in reproduction. I think that's really important to look at. I think it's really important to ask yourself, what are your values? What is important to you? How do you value other human beings around you? Is it related to their reproductive abilities? Is it only related to their reproductive abilities? I want you to think about this because cognitive fusion is you are your thoughts. And some work you can do at home is really try to pull yourself away from those thoughts. Sure, you're having those thoughts, but it doesn't mean they're real, and it doesn't mean that they're necessarily true. Go ahead and take some time to think about, what do you value in others? What do you value in yourself? I'm going to guess a lot of it has to do with a lot more than reproduction. I know reproduction is top of your mind right now as you're going through your family building journey, but one way to calm that down and to find a little bit more peace in the process is to try to separate what values you have of others and yourself. And I guarantee that's not all in reproduction. Have you been going through fertility treatment and family building and feel that you are just absolutely losing trust with your body? If so, follow along. One of the most common things that I'm helping people with is how to reestablish trust between themselves and their bodies. So what happens often, and this may be true for you, is through fertility treatment and family building, all of a sudden, no matter how many different functions your body may be able to perform and do, the focus is only on your reproductive function. And if that isn't going how you want to, trust for the entire body sometimes can go out the window. So some of the things that I help people do is explore and process some of the relationship they have with their body and how that's changed over time. And slowly we pick tools to try to rebuild that trust over time. Another area that really comes up often when it comes to losing trust with bodies, especially for the person who's receiving the fertility treatment, is once you get treatment, whether it's IUI or IVF, and waiting for that positive pregnancy test, people are intensely body scanning. Do I think I'm pregnant? What was that feeling? Do I feel any different? And that's a normal, natural response as you're waiting for a pregnancy test and the results. But what ends up happening is the hyper focus on your body often can trigger you to think you're pregnant, because you will feel changes, because outside of fertility treatment, you're honestly just distracted and not paying attention to sometimes those small body sensations. So that's another area where trust can often get broken, because people feel like as if their body's playing tricks on them. I really felt different. Of course you felt different. And this could be true if there's a positive pregnancy test, but it could be true if there's not so much hyper focus on the body and how your body feels. This is why for many people, what I really encourage them to do as they're waiting for a pregnancy test, have other things that they can do with their time so it can kind of pull them away a little bit more from the intense body scanning. It doesn't completely go away, but just a gentle pull away from that can have a real big impact when we're trying to build trust again with someone's body while they're going through fertility treatment. Tip: if you're going through fertility treatment and you're feeling really overwhelmed by the amount of information that you're absorbing, one of the things that many people don't talk enough about is how emotionally overwhelming it is to become now a student of fertility treatment. You have difficulties building your family, and now you're seeking out all this information to learn about what path to take, decisions to make, and next steps. One of the things that we do when we're really fearful and anxious of the future and for things not to be going our way is we want to do something with that energy. Not a depressive energy that kind of like shuts us down. It kind of wires us. It gets us going. And some of that energy, people often will go online to go seek out additional information that they can learn. Well, if it's not working, I'm just going to learn everything about it. I'm not saying it's not a bad idea to get educated, that's for sure. But I want you to moderate that. Moderate it like you would moderate anything in your life, because sometimes the information that you're trying to process and learn can be overwhelming. And sometimes it might be helpful to use that energy that might come from fear and anxiety and put that actually into something else that gives back. See, the more and more we go down this path of seeking more and more information, it's almost never ending. You almost can never get enough information online when it comes to many things, including fertility and family building. Carve out time where you're trying to soothe that energetic energy into something outside of learning, researching online. I'm going to share my tips for couples going through infertility. This is something that happens in a couples therapy session that you can easily do at home. I have never, in all my years of worked with a couple who experience, process, and cope with stress, anxiety, grief, sadness the same way. Here's what I want you to do. Take some time by yourself to really sit and think about your ways of experiencing these emotions, how you process them over time, and the coping strategies you use to face them, whether you like those coping strategies or not. The next step is I want you to ask your partner to do the same thing. And finally, I want you two to come together and just share your observations with one another. And what it does is it really gets rid of the myths, the assumptions that happen when couples are not going through an emotional experience the same way, and make assumptions about the other person maybe not showing up in the way you want them to, and therefore they're not caring for you. if they cared for you more, it wouldn't feel so bad. So the times, almost 99.9% of the times I'm working with couples, the care, the love, it's there. But the assumptions on how it's going to show up really can vary. And understanding each other and how you move through this difficult time is going to be crucial. Just because your partner may not hold that infertility diagnosis, they weren't diagnosed with infertility, does not mean that they're not going through an emotional experience. What I see often is that person is really trying to hold it together. I'm not saying it's helpful, but that's what they're trying to do. See, the intention is care and the love is there, and just let me hold this together and create all this space for my partner. What I think would be great is for you to acknowledge, hey, this must be bothering you too. Hey, I'm not hearing much from you. And remind the person that you would like to hear about their experience. If you're that person who is not diagnosed with infertility in the relationship and you are not sharing how hard this is for you emotionally, I'm telling you that's a mistake. I know that your intention is probably to create all this space for your partner. And so your intentions are great, but it's backfiring because infertility is so isolating. Feel isolated in pain is really hard. What I'd like you to do next time is share with your partner, hey, I'd like to talk to you a little bit about what my emotional experience is like going through this. And because I'm sharing this, you don't need to problem solve it. You're not responsible for that. But what I don't want you to feel is so alone in this pain. I want to talk about something that I hear often from a lot of the women that I work with that are going through fertility treatment and some of the challenges they're having with their spouses or partners. One of the things that I hear happening a lot is women are sharing how hard it is because their partners or spouses are complaining that they're either negative, that they're thinking the worst case scenario, that they're not as hopeful. I want to make it really clear that that's normal. When you're going through fertility treatment, it is normal that anxiety symptoms are going to really increase. And what comes along with anxiety symptoms are a lot of rumination that can lead to negativity, irritability. When we're really worried, we try to think about the future and think of the worst case scenarios as if it's going to prepare us for it. Now we know logically that's probably not going to work, but emotionally it's just a really hard thing to avoid. For some people, they're so anxious that they want to think of the worst case scenario also to think about, well, if this doesn't work, or maybe it didn't work before and it might not work again, I need to think about plan B, C, D, E, and F after. Whatever someone is doing, please know their emotional reactions are normal. So I'm going to give you 4 different things that I need you to do when your partner or spouse is sharing information like this that's indicating there's some anxiety going on. Step 1, I want you to say, wow, you seem really negative today. I can see that you're thinking about the worst case scenario or the what ifs. You must be really scared. Just seeing it for what it is. Anxiety is rooted in fear. So name it. There's nothing better than when you're emotionally overwhelmed is to be seen by somebody else. 2, I want you not only to see them, but I want you to validate it and say, and I can absolutely see why you would be thinking that way, feeling that way, that makes sense to you. You might not like it because no one wants to see their partner in pain or spouse in pain, but you can see why they might feel that way. Fertility treatment, there's no guarantee. It's really overwhelming physically, emotionally, and even cognitively. There's a lot of decision making. Okay, so we're going to see someone, we're going to validate someone, and the next step that I want you to do is I want you to join them. I bet deep down inside somewhere you're also scared too. And I'd like you to go to that place, even if you're feeling hopeful that there might be some fear in you too. Go ahead and join them. Fertility treatment can be so isolating, and no one certainly wants to be isolated in their own family. And last but not least, when asking your partner or spouse, when you're scared, what can I do that can help you feel emotionally safe? What can I do to support that? Do you need a hug? Just find out what it is. If there's anything you can do in that moment. And even if the person says, I don't know, say, okay, no problem. I'm going to keep checking in on you today. You coupled going through fertility treatment and your partner keeps saying, this is just too much. There are so many couples that I help through, this is just emotionally too much. And what I see often is a person who's actually receiving physically the fertility treatment is emotionally dysregulated and having major emotional ups and downs. But I want to clue you into something. There's no such thing as being too much when it comes to these emotions that you're likely to be experiencing. We have so much research also that backs this up, that you are likely, if you're having trouble trying to conceive and going through fertility treatment, to have anxiety, depression, even trauma symptoms. So there's no such thing as being too much. So I wanted to clear that up first. But what that might be telling you, if you have a partner complaining that it's emotionally too much, is that they themselves are struggling to manage emotions. Their couples often get stuck in that you're not here nurturing me. I need you right now. I don't think there's anything wrong with speaking out loud about that and advocating for your emotional needs. But I also think there might be another conversation to have alongside of that, which is talking to your partner about what is so emotionally overwhelming for them. And one of the reasons why I find these partners are feeling like this is emotionally too much is because they're struggling with how to manage emotions, and their own emotions included. So if you're partnered with someone who's struggling to manage their own emotions, they're going to have a hard time showing up and nurturing you during your emotional overwhelm. So some of the things that I think can clue you into their skill level with this is, can they identify their emotions? Can they identify and label a variety of emotions that they're experiencing? Next step, can they manage these emotions, cope with these emotions, soothe these emotions? If they themselves can't do this within, it's going to be really hard for them to help other people, including yourself, through this time. You advocating for your needs is not the issue here. The issue and the other conversation I'd love you to have and explore is, what skills do we have? And each partner might be coming to the relationship with a different amount of skill or skill level, and that's worth exploring. Let's talk about some symptoms that you could be having that indicate it might be a good idea to talk to a fertility counselor like myself. What do I typically see with patients I work one-on-one with who are going through fertility treatment and infertility? I'm usually seeing a couple things. I'm usually seeing depression and I'm seeing anxiety, and I'm usually seeing it all at the same time. Depressive symptoms that allow people to function, show up at their work, show up in relationships to some degree, but it's a real struggle. Lose interest in things that they normally are interested in, have a lower self-esteem, really struggling with hopelessness, concentration, sleep, some even just those things that help you feel like you can show up for life are really, really difficult. Constant worry, constant rumination are able to still show up and function, but it becomes such a task. And these anxiety symptoms can really get in the way of their quality of life. I really want to highlight how overwhelming it can be to be diagnosed with infertility. There is so much to learn and process about this whole medical procedure that it's really hard to attend to your mental health during this time. It's really hard to know, what do I need? Where am I at? Even assessing yourself. What should you look for in a fertility counselor? I think when you're looking for a fertility counselor and you're really interested in what kind of experience and training that they've had that makes them really prepared for this work, I might want to look a little bit at the space that they work in. One example is my practice. My practice, this is all we focus on. We just focus on fertility, family building, third-party reproduction. And so when you see a group practice like that, and there's several out there, you can guarantee that all the therapists are educating one another on the practice. They've had postgraduate work when it comes to fertility, and they continue to do that through their continuing education, which is required by their licensure each year. One of the guarantees in a group practice like this is all the therapists are consulting with one another, which only elevates their education and experience over time. So if you happen to find a fertility counselor and they're not a part of a practice like this, that's okay too. Some of the things that you might want to look into is a little bit in their bio. Not necessarily where they went to school, unfortunately, and I hope this changes, but there are not fertility tracks. There's not reproductive health tracks in a lot of the graduate programs in psychology, and I hope that changes. In their bios, what are they talking about as far as their education with their postgraduate work? What kind of trainings have they participated in? One in particular that you might hear about that is a great one to look out for is the American Society of Reproductive Medicine. Has some great training. Have they completed that? And finally, the last step is go ahead and have a consultation with someone. Have a conversation. I guarantee you're going to know if they're a good fit. Having a consultation and just asking, hey, do you mind if I talk to you about some of the things I'm struggling with? And then you could share with me how you might work with someone like me could also give you a lot of great insight into whether that person's a great match.